Thank you, Chris. Let's remember that there are some good things that we've seen happening in healthcare over the last year. Our uninsured rate dropped by over 40%. We now have more than 95% of Minnesotans who have health insurance, and I think that puts us second in the nation behind Massachusetts, which of course had Governor Romney's program 10 years ago. One of the reasons for that was that over 300,000 Minnesotans were able to purchase health care through MNsure, through the exchange that we developed as a state. And because we developed that exchange as a state, we were able to do it the Minnesota way. We folded MNcare into the MNsure exchange, as well as qualified health plans through the private market, and also Medicaid. Through MNsure, more than 300,000 Minnesotans have signed up for health care and are now added to the ranks of people who are actually insured in Minnesota, and that's a good thing. Another thing about MNsure is they're the lowest rates in the country, and that's a good thing. If we had neglected to do MNsure, if we had just let folks in Minnesota go into the federal exchange, which was the option, that was the other option, people would be paying more. People who had enrolled through the federal government's health exchange would have been paying more. So we've saved Minnesotans money by establishing MNsure. Now, were there some problems with the rollout and some technical issues and some privacy issues? Absolutely. And those issues have been addressed to some degree and need to continue to be addressed. So we need to look at what the problems are. We need to fix the problems. But what we cannot do is go back to the time when health insurance companies called all the shots. They could refuse to cover people because of a pre-existing condition. We don't need that. We can't go back to the time where they could cut you off of insurance as soon as you get fixed. That's not good for people. So we've got to continue to move forward, fix the problems, and make sure we have affordable coverage for everyone.